So first I will start with this multiple choice question. It is a case scenario based question. So it says, a mother informs the pediatrician that she wants to hold down her daughter during venipuncture since the girl is extremely fearful of needles. Okay. When the girl sees the venipuncture needle and becomes anxious, which of the following circulatory bed will respond with minimum percentage in blood flow compared to pre-stimulation? Are you getting what the scenario is? Okay. So a girl, right, is getting an injection, okay, intravenous injection, okay, and she is frightened, she is scared, right, she is frightened, she is scared. So the girl is extremely fearful of the needles. When the girl sees the venipuncture needle and become anxious. So what happens when someone becomes anxious? What happens when someone becomes scared? What happens? Yes, heart rate increases, okay. There is vasoconstriction, all the blood vessels undergoes constrictions, okay. So these things are due to increased catecholamine secretion, okay. When someone is getting anxious, this is acute stress, right. This is called acute stress, okay, and acute stress is characterized by increased catecholamine secretion. Catecholamines means? Yes, very nice. Epinephrine, norepinephrine, okay. So they will increase heart rate, number one, and they will do vasoconstriction, okay. So once there is vasoconstriction in all the vascular bed, okay, that means reduced blood supply. Vasoconstriction means reduced blood supply, okay. So reduced blood supply to your heart, to your kidney, to your brain, to your skin, everywhere there will be vasoconstriction, right. Everywhere there will be vasoconstriction. Now the question asked, which of the following circulatory bed respond with minimum percentage decrease in blood flow compared to pre-stimulation? Getting my point? So which organ is auto-regulated? That means which circulation is minimally affected. So when the girl is getting anxious or the girl is getting scared, blood supply to skin hampered, blood supply to kidney hampered, blood supply to liver hampered, everywhere hampered. But there are two vascular beds in human body which are least affected, okay. Even if there is vasoconstriction, blood supply almost remains unaltered, and these two vascular beds are, because these are two vital organs, okay. These are two vital organs. So if there is vasoconstriction and reduced blood supply in those organs, the effect will be fatal, right. So this is why we have a homeostatic regulation, we call it autoregulation, okay. Even if there is sympathetic stimulation, sympathetic stimulation means adrenaline, noradrenaline doing vasoconstriction and tachycardia, increased heart rate, right. So even if there is sympathetic stimulation, all these things are happening due to sympathetic stimulation, okay. Adrenaline, noradrenaline, epinephrine, norepinephrine, they are being secreted because of sympathetic stimulation, right, okay. So even if there is sympathetic stimulation, your heart and your brain are able to maintain blood flow at a fixed level, okay. We call it autoregulation, okay. So autoregulation is very strict in coronary circulation and cerebral circulation, okay, because brain cannot tolerate hypoxia for much time, okay. So autoregulation is must, right, and heart is a major organ in cardiovascular system which supplies blood to all the organs. So heart's own blood supply is to be maintained, right. So this is why autoregulation is strict, very strict in those two organs, one is brain and another is heart, right. So, answer is cerebral and coronary circulation will respond with minimum change in blood flow, okay, or almost there will be no change in blood flow because of the presence of autoregulation. Okay. The mechanism of autoregulation for coronary circulation and the mechanism of autoregulation for cerebral circulation frequently comes in your examination, right, in first professional MBBS examination. Autoregulation is also there. Remember, autoregulation is also there in renal circulation when we will take classes on renal physiology or nephrology, right. So, during those time you will see that kidney is also having autoregulation, but it is not very strict, right. Okay. So, this is why here renal circulation option is not here, but even if there was an option as renal circulation or kidney circulation, still your answer will be cerebral and coronary circulation. Okay. But remember, autoregulation is also there in kidney, right. Okay. Next. This figure shows the brachial artery pulse pressure. Okay. What do we feel our pulse? Here, radial artery. Okay. Usually radial artery, but we can examine pulse in other areas as well, like brachial artery, right, located here, brachial artery. So, this figure shows brachial artery pulse pressure during one cardiac cycle. Okay. So, pulse pressure rises and comes down. Okay. On the y axis it is pressure and the x axis it is time. Okay. So, this is brachial artery pulse pressure during one cardiac cycle at which of the following times level A to E is left ventricular coronary blood flow is highest. Okay. কোন পয়েন্টে লেফট ভেন্ট্রিকুলার করোনারি ব্লাড ফ্লো সবচেয়ে বেশি হবে, রাইট, whether it is A or B or C or D or E. Okay. So, we will be able to answer this question after today's class. Okay. So, I am skipping it. So, see the answer, it is C. Okay. So, blood supply to your heart, I guess it is not covered yet in anatomy. Okay. Thorax এখনো হয়নি, right, superior extremity গুলো হয়েছে, right. Okay. So, I will not go in much detail about coronary circulation, which will be covered in your anatomy, but the basic things, right. So, there are basically two coronary arteries, one is left coronary artery, another is right coronary artery, which arise from the base of the aorta, from the posterior part of the aortic valve clasp, behind the aortic valve cusp, right. So, this one is your left coronary artery, this one is right coronary artery. Major branches of left coronary artery is circumflex artery and anterior descending artery. Okay. Circumflex artery and anterior descending artery. Okay. These are two major branches. There is also left marginal artery which arises from the left coronary artery. Okay. And here is your right coronary artery. The major branches are posterior descent. So, during isovolumetric contraction, blood flow comes to 0 in left ventricle, 0 ml per minute, and throughout the systole it maintains around 40 ml per minute, and in diastole, at the beginning of diastole, see, blood flow is highest almost at the beginning of diastole. Blood flow is highest around 100 or 100 plus ml per minute. Okay. Again, in late diastole it comes down. Okay. Okay. Now, at which of the following times left ventricular coronary blood flow is highest? Acha, arterial pulse পড়া হয়নি না? Sorry. So, this is this C corresponds, this point C, it corresponds to beginning of diastole, okay, where blood flow is highest. So, that is why answer is C, right, in point C. This is arterial pulse pressure, right, arterial pulse pressure. This notch is called dichrotic notch. Okay. This notch is called dichrotic notch. It happens because of the closure of the aortic valve, right. Okay, after systole, aortic valve closes. So this notch is due to closure of the aortic valve, and it signifies the beginning of diastole. And you know, at the beginning of diastole, the left coronary blood flow is highest. Okay, so this is why the answer is C. Okay, you will be again be able to understand it better when you will study the pulse pressure curve. It is a practical topic, we will discuss in practical, right? Okay, so now you should have that concept that left ventricle, we are not talking about right ventricle yet, আমরা right ventricle নিয়ে কিন্তু এখনো কোনো কথা বলিনি, right? So for left ventricle, at the beginning, that is during isovolumetric contraction, blood flow comes to 0, and throughout the systole it maintains around 40 ml per minute blood flow, and at the beginning of diastole, blood flow is highest, which is 100 plus ml per minute, right? Okay, okay, I will not show this first. Okay, so if I insert a cannula directly, into the aorta, we get a pressure 120/80, right? Now aorta कहाँ से originate होता है? Left ventricle से, left ventricle से. Okay. So see, if I insert a cannula into radial artery, I get 120/80. Brachial artery, I get 120/80. Aorta, 120/80. If I insert a cannula inside left ventricle, from which aorta is arising, what is the pressure? It should be slightly more than 120 because blood is coming from left ventricle to aorta, right? Blood is moving from left ventricle to aorta. That means in left ventricle there will be a pressure head which is slightly higher than the aortic pressure, right? Okay. So what in systole and what in diastole? What will be the systolic pressure in left ventricle and what will be the diastolic pressure in left ventricle? That means when your left ventricle is contracting, what is the maximum pressure? And when your left ventricle is getting relaxation, in relaxation, what is the minimum pressure? Just like in your radial artery or brachial artery or aorta, it is maximum pressure is 120, minimum pressure is 80. It is 120 plus, you can consider it 121 in left ventricle, systolic pressure. And what is diastolic pressure? Not 80, 0. There is no pressure, right? When your left ventricle is relaxing, inside pressure is 0. Okay, now tell me why in aorta the systolic pressure is 120 and diastolic pressure is 80. During diastole, left ventricle is relaxing, right? That means within left ventricle pressure comes to 0, but within aorta pressure is still 80. Because your aorta is elastic structure, okay? So when left ventricle pumps blood into the aorta, aorta undergoes stretching, okay, during systole, and during diastole it recoils, okay, and compress the material inside which is blood, okay. So that is why during diastole inside the aorta pressure is high. Getting my point? It is called Windkessel effect, right? So aorta is elastic structure made up of elastin, made up of collagen. Okay, there are lots of elastin and collagen in the vessel wall. Okay, we have studied tunica media, tunica adventitia, tunica intima, right? So there are lots of elastic structures. Okay, elastin and collagen mainly. Okay, and they are responsible for this Windkessel effect. Okay, so left ventricle pumping, inside left ventricle during systole pressure is 120, left ventricle relaxing, inside pressure is 0. Okay. So when left ventricle contracting, the pressure is being transmitted to aorta. So in aorta also there is high pressure during systole, that is 120 millimeter of mercury. But when left ventricle is relaxing, this aorta is compressing blood inside because of the elasticity. Okay, right. So during systole, aorta is stretched. During systole, aorta is stretched. Okay, and it recoils back during diastole. That maintains the diastolic pressure within the aorta. Right, it is 80 millimeter of mercury, but there is nothing such event happening inside the left ventricle, right. So inside the left ventricle, diastolic pressure is 0. So if I put a cannula into radial artery, I get 120/80, brachial artery 120/80, subclavian artery 120/80, aorta directly 120/80, but if I insert a cannula in the left ventricle, 121/0. 121/0. Okay. Okay. Now if I put a cannula into the pulmonary artery, if I put a cannula into the pulmonary artery, from left ventricle aorta originates, from right ventricle pulmonary artery originates. Okay. So if I put a cannula into the pulmonary artery, I get a pressure. Okay, normally the pressure we measure कि मैंने pressure माप लिया और बताया कि ये 120/80 है या फिर 130/90 है, जो भी है, ठीक है, this is called systemic pressure. ठीक है, हम लोग बोलते हैं ना blood pressure, it is not exactly correct, you should tell systemic pressure. Okay, systemic pressure. So if I am to measure the pulmonary arterial pressure instead of aortic pressure, instead of brachial artery pressure, instead of radial artery pressure, if I measure pulmonary artery pressure, yes, it is less, definitely it is less, because pulmonary vasculature is a low resistance circuit. Okay, that means your right ventricle easily pumps blood into pulmonary circulation because the resistance is low, right? And you know, right ventricular musculature is also less, right? Okay, right ventricle के अतो काज करते हैं ना, left ventricle के अनेक बेशी काज करते हैं because systemic vascular resistance is high. So if I insert a cannula directly, we cannot measure pulmonary just like putting a cuff and measuring blood pressure. Okay, directly we can measure systemic blood pressure. We cannot directly measure pulmonary vascular pressure. Why? Because it is directly going into the lung. Okay, and you cannot place a cuff there, right? Okay, so to measure pulmonary arterial pressure, we need to cannulate the patient, which is an invasive procedure, right? That may be done in the ICU setting if required at all, right? Okay, so to measure, if we measure pulmonary arterial pressure at all, it is 25/9 millimeter of mercury, just like 120/80 in systemic vascular, right? If I measure pulmonary arterial pressure, it will come 25/9, standard value, normal value, right? 25/9 millimeter of mercury, pulmonary arterial pressure. Now, if I put the cannula inside, जहाँ से pulmonary artery originate होता है, that is right ventricle. If I put the cannula here, what will be the pressure? 25/0. Yes, 25/0. Okay, slightly higher than 25. Okay, we can consider it 25/0. ठीक है? Okay. So aortic pressure 120/80, left ventricular pressure 121/0, pulmonary arterial pressure 25/9, okay, right ventricular pressure 25/0, ठीक है? Because again pulmonary artery has this stretching effect, but not the right ventricle. Okay, again right ventricle, when right ventricle will contract, the diastolic pressure will come to 0. Correct? Okay. Now see this. So systole, diastole, aorta 120/80, left ventricle 121/0, right ventricle 25/0. Clear everyone? Okay. Now, when we consider coronary blood flow, okay, coronary blood flow. So coronary arteries are going into left coronary artery grossly. Grossly, your left coronary artery is supplying the left ventricle and right coronary artery is supplying the right ventricle, grossly. Okay. So, left coronary artery is going into the left ventricle. Okay. Okay. Now, the pressure within the left ventricle, it is against coronary blood flow. Do you agree or not? The pressure within the left ventricle, it is working against coronary blood flow, right? But the pressure within the aorta, it is trying to send blood into the coronary artery. Okay. The pressure within the aorta is sending blood within the coronary artery, but the pressure within the left ventricle, it is sending blood back to aorta. Correct. So, the difference between aortic pressure and left ventricular pressure is the determinant of left coronary blood flow. That means aortic pressure minus left ventricular pressure. Okay. Clear everyone? Always pressure gradient is responsible for blood flow in any organ. Right. So, aortic pressure is trying to send blood in the coronary artery because coronary arteries are originating from the aorta, right? But the pressure within the left ventricle is resisting it, right? So, the pressure difference, aortic pressure minus left ventricular pressure, okay? Aortic pressure minus left ventricular pressure, this pressure head, aortic pressure minus left ventricular pressure is the determinant of blood flow in left coronary artery, and aortic pressure minus right ventricular pressure is the pressure head that is determinant of blood flow in right coronary artery. Clear? So, what is happening during systole? During systole, aortic pressure 120 millimeter of mercury. During systole, aortic pressure 120 millimeter of mercury and left ventricular pressure 121 millimeter of mercury. Okay. So, the difference between aorta and left ventricular pressure is 120 minus 121, that is minus 1 millimeter of mercury. So, during systole, blood is moving towards opposite direction, towards aorta. That means left ventricle is not being perfused, left ventricle is not getting any blood. Clear? Okay. During diastole, what is happening? Aortic pressure is 80 and left ventricular pressure is 0. So, 80 minus 0, that is plus 80. So, during diastole, your left ventricle is getting blood adequate with a pressure head of plus 80 millimeter of mercury. Correct? Okay. Now, what is happening in case of right ventricle? In right ventricle, pressure head is 25 by 0. So, during systole, aortic pressure minus right ventricular pressure, aortic pressure minus right ventricular pressure, 120 minus 25, that is plus 95, and during diastole 80 minus 0, that is plus 80. So, right ventricle is getting blood every time, whether it is systole or diastole. Okay? Right ventricle is getting blood every time with a pressure head of plus 95 millimeter of mercury during systole and plus 80 millimeter of mercury during diastole. But your left ventricle is getting blood only in diastole with a pressure head of plus 80 millimeter of mercury, and during systole your left ventricle is not getting blood. On the contrary, some blood is moving backwards towards the aorta with a pressure head of minus 1 millimeter of mercury. Clear? जिसको ज़्यादा blood चाहिए उसको नहीं मिल रहा है, और जिसको कम चाहिए उसको ज़्यादा मिल रहा है, right? Clear? Okay. So there is a huge problem with this, right? So this is why, due to presence of this scenario, your left ventricle, not your patient's left ventricle is more prone to develop ischemia. Okay? We talked about ischemia and infarction in our previous class. Okay? So that is why left ventricular muscle mass is more, left ventricle is getting compromised during systole. Okay? Left ventricle is getting less blood during systole. Okay? Not less blood, On the contrary, blood is moving towards opposite direction, that is left ventricle to aorta during systole, right. So, blood is snatched from left ventricle to aorta during systole, okay. So, this is why left ventricle is more prone to develop ischemia, correct, okay. You may get a question, explain why type of question. So, you need to present this table and explain. Okay. So, even if there is this huge problem with the blood supply in left ventricle, particularly during systole, we have a good thing which saves us, okay, and that life saving mechanism is called autoregulation, okay. This life saving mechanism is called autoregulation, where coronary blood flow remains constant between 60 to 200 millimeter of mean blood pressure. Okay, what is mean blood pressure? May I ask you, what is mean blood pressure? Your systolic pressure is 120, your diastolic pressure is 80. What is your mean pressure? 120 plus 80 by 2. Galat. 120 plus 0 by 2. Your cardiac cycle length is 0.8 second. How much is systole and how much is diastole? 0.3 second systole, 0.5 second diastole. Right? Okay. Then why are you telling that it is 120 plus 80 by 2? No, I ask about mean pressure. आपका systolic pressure 120 है, that is you can consider that within the cardiac cycle throughout 0.3 second you maintain a pressure of 120 millimeter of mercury and throughout 0.5 second you maintain a pressure of 80 millimeter of mercury. Getting my point? Okay, যদি এটা হতো, had it been the scenario that your systole was 0.4 second and diastole 0.4 second, total 0.8 second, then your answer would be 120 plus 80 by 2. Your systole and diastole duration is not equal. You cannot just simply average it, right? Getting my point? So, the effect of diastole is more in your mean pressure because it is staying more, 0.5 second, right? So, it will be somewhat towards diastole, 120, 80, 120 or 80 মাঝে midpoint is 100, okay, but it will be less than 100 towards diastole because the effect of diastole will be more in calculating your mean pressure, okay. To actually calculate your mean pressure, we should integrate it, okay. 0 to 0.3 PDP plus 0.3 to 0.8 ऐसे करके, right? You need to integrate, okay. But there is a shorter way, okay. So the answer is DBP plus 1/3 of PP. PP means pulse pressure. Pulse pressure is equal to systolic pressure minus diastolic pressure. Okay. So it comes to DBP plus 1/3 SBP minus DBP. Correct? So it comes to 1/3 SBP plus 2/3 DBP. So you see, it is not half SBP plus half DBP. So effect of diastole is more, okay. Effect of diastole is more in calculating mean arterial pressure, okay. Diastole का 2/3 and systole का 1/3, right. If you calculate it, it will come to 93.3 millimeter of mercury, okay. It is your mean arterial pressure, Okay. Diastolic blood pressure is 80 and pulse pressure is, if you calculate in this way, dBp plus 1/3 pp. So dBp is 80 millimeter of mercury and pp is 40, 120 minus 80, right? So calculate here, dBp is 80 plus 1/3 into 40. So 80 plus 13.3, 93.3. Clear? Okay. যদি তোমার সিস্টোল 0.4 সেকেন্ড হতো, ডায়াস্টোল 0.4 সেকেন্ড হতো, তাহলে মিন প্রেসার হতো 120 plus 80 by 2. But as your systolic duration is 0.3 second and diastole duration is 0.5 second, so the effect of diastole will be more. To calculate the exact mean arterial pressure, we need to integrate, but there is a shorter way, that is 1/3 of systolic blood pressure plus 2/3 of diastolic blood pressure, and the value will be 93.3 millimeter of mercury. It is your mean arterial pressure. Okay, and it says that coronary blood flow remains constant. Okay, during our subsequent classes, I will show you the importance of mean arterial pressure. It is a very important determinant of perfusion pressure. Okay, it is the mean arterial pressure because of which your organs are perfused. Your all organs are getting blood because of presence of mean arterial pressure. Okay, because if you enter into the small capillaries, okay, aorta, then subclavian artery, then axillary artery, then brachial artery, then radial artery, ulnar artery, then small arteries, okay, the digital arteries, okay. এখানে যদি তুমি pressure মাপো, if we measure pressure in the digital arteries, the small capillaries that goes into the organ, okay, you will not get 120 by 80, you get a mean pressure. Right? Okay. So if I insert a cannula here in aorta, right? In aorta, if I insert a cannula, you get this fluctuation 120/80, 120/80, 120/80. Okay. Aro kache jao radial artery te chole esho. This fluctuation is less. Okay. Small fluctuation. Aro digital artery te chole esho, a constant pressure. Okay. This 120/80 fluctuation কমে যাবে if I move to the periphery. Okay, if I move to the periphery, and there will be a constant pressure, and that is mean pressure, mean of systolic and diastolic, that 93.3 millimeter of mercury, and that mean pressure is the determinant of perfusion. Your liver is getting blood, kidney is getting blood, your skin is getting blood. Okay, all the organs are being perfused because of the presence of mean arterial pressure. Okay, and it says that heart gets blood adequately within a range of 60 to 200 mean arterial pressure, 60 to 200 millimeter of mercury mean arterial pressure. Within this range your autoregulation works, but if mean arterial pressure falls below 60 or mean arterial pressure goes above 200 millimeter of mercury, this autoregulation does not work, and your left ventricle may get compromised. Okay, this autoregulation fails. Okay, okay. Now, what is the mechanism of this autoregulation? It comes as in your question. Okay, what is the mechanism of autoregulation? It is a totally local event. Okay, autoregulation is totally a local event. Okay, so how this local event work? So apparently আমাদের কি মনে হবে যে একটা পেশেন্টের left ventricular blood flow already compromised. Okay, your left ventricle is not getting blood during systole, हमने पहले देखा है, right? He left ventricle is not getting adequate blood during systole, ये हमें पता है, right? And on the contrary, at the beginning of systole, that is during isovolumetric contraction, blood is snatched from left ventricle with a negative pressure head of -1 millimeter of mercury, right? Okay. Now, if I increase heart rate, okay, say the patient is running or the patient is excited or the patient is scared, right, due to some reason. So what happens? Increase heart rate, more oxygen demand will be more. So apparently it seems that left ventricle will be more compromised. ठीक है, ऐसे ही सिस्टोल में ब्लड नहीं मिलता है, ऊपर से पेशेंट को आप दौड़ा रहे हो, राइट? Okay, it seems, but at the cellular level, some different events happens. Okay, so the patient is scared or the patient is running, that means sympathetic activation, right? Sympathetic activation means secretion of catecholamines, epinephrine, norepinephrine, right? It will stimulate the beta 1 receptors present within the heart, okay? And there will be increased heart rate and increased contractility. Heart rate will increase and heart will pump forcefully due to the effect of catecholamines, okay? So if heart contract forcefully and heart rate increases, there will be more ATP consumption, right? More ATP consumption, that means more metabolism, okay? And this ATP will be converting into adenosine. ATP breakdown, formation of adenosine. And you know what adenosine is? Adenosine is a potent vasodilator, right? Adenosine is a potent vasodilator. Other than as the adenosine, there are other metabolites like lactate, H+, prostaglandin, right? So আমরা কি ভাবছিলাম যে হার্ট রেট বেড়ে গেলে এমনিতেই সিস্টোলে লেফট ভেন্ট্রিকল ইজ নট গেটিং ব্লাড, তারপরে হার্ট রেট বেড়ে যাচ্ছে, কন্ট্রাক্টিলিটি বেড়ে যাচ্ছে, তাহলে ব্লাড ভেসেলগুলো আরো স্কুইজ হয়ে যাবে, আরো ব্লাড পাবে না লেফট ভেন্ট্রিকল, এটা মনে হচ্ছিল। বাট দ্য ডিফারেন্ট থিং ইজ হ্যাপেনিং, ওকে? দ্য থিং ইজ due to this increased mechanical activity, ATP consumption is more, and from ATP we get adenosine, which is a potent vasodilator, okay? Adenosine locally blood vessel গুলোকে dilate করে দেয়, right? So that যে মাসেল গুলো blood পাচ্ছিল না due to vasodilation, it gets slight increased amount of blood, correct? And this phenomenon is called functional sympatholysis or reactive hyperemia, okay? And this causes coronary vasodilation, okay? Due to the effect of adenosine instead of vasoconstriction, because sympathetic stimulation will do vasoconstriction everywhere, okay? हमने पहले देखा है कि sympathetic stimulation will cause vasoconstriction everywhere, okay? In liver, in kidney, in skin, in brain, everywhere blood vessels undergoes constriction, okay? But not in heart because of the presence of adenosine. It is a local effect, right? So within the cardiac myocytes, adenosine concentration is high, and this adenosine causes vasodilation, okay? So J left ventricle during systole blood পাচ্ছিল না, due to the effect of adenosine, it gets slight increased amount of blood, okay, which prevents development of ischemia, ठीक है? So this one is very important, functional sympatholysis or reactive hyperemia. It is the mechanism of autoregulation in heart, okay? That's all about coronary circulation, okay? Any question if comes from coronary circulation, if you attend this lecture, you should be able to answer all the questions. Clear? Okay. Chalo, thank you. And remember this thing as an MCQ. It frequently comes as MCQ. Oxygen consumption of normally beating heart is 9.7 ml per minute per 100 gram of tissue. Okay? 9.7 ml per minute per 100 gram of tissue. It is a recall based question, right? A data based question. Okay? Very frequently it comes as an MCQ.